My name's Rubina, and I'm with the academic recruiting team. I work for Aspen Dental Management. So we are the support organization that helps with Aspen Dental and our Aspen Dental dentists. We're the non-clinical support for all of our doctors so that our doctors just, like Dr. Tran here, can focus on dentistry. So we're here to help with all of that. So before we begin, I just want to let you guys know that on the bottom of your screen, you guys have the ability to ask questions and we are going to be here to answer them. So I'm here to be a moderator. So I'm going to go through those questions that you guys submit in that box, as well as ones you've submitted prior to in a Google form. So if you see me going like this and looking away, it's not because I'm ignoring anyone or looking at anything else. It's just I'm focusing on the questions to help Dr. Tran keep this going and answer everything that you guys might have regarding Aspen or her journey prior to Aspen and whatnot. So there's also an option to raise a hand, but I would just avoid that since we can't actually verbally communicate with one another. So using the question and answer box will be the best format for this session. So without further ado, I'm going to have Dr. Tran speak and introduce herself, and we will go from there.
Hi, I'm Dr. Tran. I've been with Aspen Dental for almost 6 years, and we opened one of the first offices in Minnesota. So it was kind of neat to continue the journey for so long, and I've been out of school for 11 years now. So it's a long time, and I finally found my home in Aspen, and I think I'm just going to stay here forever. In general, that's kind of, I've had a long journey. So I came to Aspen 6 years, pretty much out of school, 5.5 or so. And I just had a lot of experience and background. But when I came to Aspen, I felt like everything came together for me. And it just made sense that I'd stay.
Wonderful. So what options did you have coming out of dental school? Why did you choose Aspen?
So coming out of dental school, Aspen wasn't here. And one thing that I realized is that I truly wished, now that I've been at Aspen, that it was here. So I was, I had like 4 different job interviews, private clinic, public clinic. I chose the public clinic part-time and private clinic part-time so that I could have a little bit of both and understand both fields. With public clinic, I had, you had to do everything. And so if a patient came in and it was a tooth and it was really hard, you just did it. You just took up a tooth for them and did their root canal because they had nowhere else to go. But with that training, I took it, into my private clinic where it was mostly like people who took care of themselves. So there wasn't as much to do, but it wasn't as challenging. But when I came to Aspen, what I realized is like, I wish I was here first. And so I didn't have to work at 2 different places. I could put everything together. Like with Aspen, you had so many procedures that you could do, and you had so many patients that you could see. The difficult ones, you always had a doctor there with you, and you like usually start with like a mentor doctor and things like that, and you felt supported. Like you weren't just left alone, and so you grow so fast in that field, and I wish I had that coming out of school.
So when you started, I just had someone ask, did you have a mentor? Were you able to speak to them constantly? Were they easy to access? How did that work when you first started?
How Aspen works with everyone, even though I came in with 5.5 years out of school, they had a mentor for me, and at that time, there was no Aspen City, Minnesota. I was opening the first one. And they flew me out to Wisconsin because there were owners in Wisconsin that I trained with. And I actually was out there like every week. They flew me homes because I was just a recently married person, and I didn't want to stay away from my husband for too long. So like I'd stay there for a week and come back on the weekends. But during that whole entire week, my mentor was with me side by side, training me on how to like look at treatment plans and making sure that we're on the same page. And we'll talk through a case before I enter the room and how I would proceed, and how would I go about that procedure. Maybe it's a little different than how she would do it, and she'll tell me how she does it versus how I would do it. We talk through a lot of cases together. So even though I came out 5.5 years, like she came from a different perspective that I didn't have. And it was nice to actually be able to take that and bring it with me in my career.
Right,
They,
definitely.
yeah, they don't leave you alone. Like you're not by yourself. But yes, she's super accessible. Even though I've been here for so long, I still text her if I come across something. So it's like you kind of have a mentor for life. But if she's not accessible, there's like clinical directors that they have within the region, and they'll designate one for your region. And you can ask them anything, literally, even if you've had a bad day and you wanted to talk through it, there's somebody there to listen.
That's wonderful. So you did mention treatment plans, and discussing treatment plans when you first started. Do you feel like now, do you do your own treatment plans? Do you um, get to do procedures that you wanted? Like, I guess when you first started, did you get to do procedures you wanted, or did the other doctor do it? How did that work? Did someone tell you you have to have like X amount of crowns? Like, how exactly did treatment planning work?
Okay, so you got to know who your patient base is at the end of the day. So even right out of school, like I worked at a private clinic and I worked at a public clinic. So the public clinic patients are not going to have crowns and bridges and Invisalign, and it's just not the patient base. And so you can explain it to them, these are your options, and it's up to them. But they're going to tell you, hey, I can't afford that. But private clinic, it's like you're going to give them all their options. They're going to decide what they want. But at the end of the day, it's the same concept. So the patient base that Aspen has is people who've neglected themselves over the years. They've taken care of their family. They're taking care of their kids. Um, they just don't get to be at the dentist, or they're scared and they've neglected themselves, right? And they're pretty much blue collar. They don't have a lot. But you talk to them, you're just like, okay, if you see a broken tooth, you look at it and you're just like, this is in the nerve. You gotta look at everything. Is there infection everywhere? What's happening in this patient's mouth? And from there, you talk to the patient and you come up with a plan that they feel good about. You don't just come up with a plan because you want to save everything. You come up with a plan that they feel good about. And of course, there's ethics. If they want to take out everything with great, perfect teeth, you don't do that. You just tell them and educate them on why you do it a certain, like you wouldn't do that. So they don't tell you a quota you have to hit, but they will tell you if you do what's best for the patient and you listen to your patient and you do comprehensive exams like you are in school, like from day one, where you have to take all the x-rays and do a full exam and explain everything and come up with a plan, that's where this patient's going to be best taken care of.
Great, thank you for that. Someone just asked, with you being an owner, how did you position yourself to get you to where you are now?
So actually, I came to Aspen. I did not want to. I did not have the best experience. I came from private clinic. I worked, public clinic, and then I transferred into private clinic for 2 years. And I wanted a partner, and they didn't. He was just like, "Hey, you can stay forever. I love you." But maybe in about 10 years, I was not going to stay there 10 years. So of course, every person that you know of as a dentist would probably be online looking for a different place or a place to own. And I found a place to own, and it wasn't the best place. It was a very bad experience. Ended up having to take him to litigation for 2 years. It was not. So I came to Aspen, and they had ownership possibilities, and I said, I don't want to own. I just want to start my life over. I just want to get married, have a family, and go from there. But when I opened this first office, everything was just so great. Like you had all the support. They did things ethically. They cared about you. They cared about your patients. They listened to what you had to say. And after I had my first baby, I was like, I can do this. But they were kept on telling me, hey, you're doing a great job, doc. Like, your office is doing good. You're getting a lot of referrals, people coming back with great reviews. Patients really like you. Your office is growing. And so they wanted me to. I didn't position myself to own, but I just came in and did the best job that I could, as any provider would. And they gave me that opportunity. They wanted me to own. So that's where I was. But I think everybody coming out of school or coming to Aspen, just do the best you can and come in and really be a caring provider and truly care about the people you see in everything you show. And your success comes from that.
Definitely. So with you being an owner, do you work? Do you practice clinically, or are you just more of administration?
I work every day. When you are an owner, you do a little bit of everything, but you kind of understand how teamwork works. So when you have another doctor, that's what you're teaching and showing them, not just the procedures and the clinical skills, but how to work as a team so everything goes smoothly. So if something doesn't go right, you're in there, you have to know how to fix it. So if you're not up to date on your clinical skills, like you're not going to be able to teach and show um, in general. Like I'm very involved in both of my clinics. So if I have to step in a procedure, I will. Usually my doctors I'll help them out and I'll train them so then they feel good. But I also run my own column. Like when I'm there, I'm not just sitting in an office all day. I'm running my own column and making sure things are going the way they should. And my doctors feel supported.
So with you being involved clinically as well, how involved are you with the hiring process of your associates, your office staff, your front staff, hygienists, all of that? How involved are you in that?
So as involved as I want to be. So let's say I have a regional manager that I think knows me very well. And if she wanted to do an interview on a day that I can't be there because I'm at a different office, I go, you know what? I trust you. If you have a good instinct, she'll go through everything with me. And if I trust her enough, we'll give the person a chance. But if I don't trust somebody, I'm going to want to be front and center. I'm going to want to be in those interviews. And I have been in a lot of my interviews with my hygienist, with my front desk, with my doctors. In general, doctors are a huge portion of what we do. We got to make sure we get along. We got to make sure that we're on the same page on an ethics standpoint, on a clinical standpoint. And how are we going to treat our teams? If you can be a great doctor, but you're not a team player, are you going to really fit my team very well? Like, I need to know that. So I want to be involved in those areas.
Definitely. I mean, the whole staff ends up being like your family. If you're going to continuously work with them, it really makes a big difference. And then also, they're going to make or break it in the office. A good office runs smoothly with a good staff.
Yep.
So when it comes to staff, again, what do you look for when you're interviewing an associate specifically? New grad dentist or even a practicing dentist? What are you looking for as your associate?
Connection. Do we have a good connection? Can I trust you? Can I feel like, you and I will be able, like, you're going to be able to come to me and feel comfortable and being open with me. Like if you're having a struggle, you're struggling, whether it's patient care or, even with staff members, are you going to be able to open up and tell me so I can help you? Also, on a clinical standpoint, what kind of clinician are you? If you're a cosmetic dentist, we may not fit very well because this is not the patient base for it. But if you're somebody who just wants to come in and help patients every day, then we're going to be fine. And so it's really connection, clinical skills you can always help somebody with. It's really connection.
Wonderful. Someone just asked, what advice would you give a dental student to be prepared coming out of dental school?
Do like keep an open mind. That's number one thing. And number two thing is that dental school lies to you a lot. So every new grad that I've tried, I just say, everything you learned in dental school, take it with a grain of salt. I will show you a different technique. And then they're all like baffled with how much they learned from me. Some of them, I've had doctors tell me, I've learned more from you in the 4 weeks of training than I had in 4 years of dental school. But, like they tell you that it's going to be perfect and life is wonderful. And life, anybody who lives a real life knows that life, no matter what, will comes with bumps. It's just not realistic. Um, but also, they're going to tell you dentistry is going to have to be a certain way. You find your own way. Like, it's not textbook. Life is not textbook in any way or form. And sometimes the more you do, the better you get at it. You don't come out of school running. So you just take what you can from everyone around you. Like, if you need another doctor, pick their brain. Be open minded. Not every procedure has to go, textbook way.
So with that training and everything, if someone just posed this, if I work for Aspen Dental or any DSO directly after graduating, will they teach me things like molar endo, surgical extractions? They also said, I kind of feel ready to go into practice, but I feel like what's taught in dental school is pretty basic, but I want to learn really more advanced techniques.
So here's the thing. Every doctor's different, right? Like, if you want to learn molar endo, I'm going to tell you I'm not the person. I don't like molar endo. I've done it. I hate it. If you talk about surgical extractions, love it. Do it every day. I'd much rather do a full mouth surgical extraction for an hour and a half, 2 hours, than to do molar endo for 2 hours. But I will tell you there's other doctors that do molar endo, and if you really wanted to learn within Aspen, we would just send you to one of them who does a very good job. I have a specialist that comes to my office once a month, and she's more than happy if you want to watch. And it's like, even if I can't physically teach you, we will find somebody who can. We have the resources. And the thing is like, and it's not just go in and do it. It's like, hey, I'm suctioning with you. I'm teaching you how to lay it flat. Like, in the beginning, like, maybe you'll suction with me and you'll see how I do it. And the next time you go in, I'll suction with you. Like, this isn't where patients are guinea pigs, right? We don't believe in that. I'm going to make sure you're going to feel good going into a procedure. I'm going to walk you through it. You're going to see it. We're going to do it together. So that's how that works. It's like a mini GPR, but even more hands-on with the doctor than you've ever had in dental school.
So you just mentioned GPRs. Um, do you advise students to go into residency? I had this posed in a prior Ask Me Anything. They asked, should I even go into residency? Do you think that Aspen gave you enough support not to have gone into residency?
I'd say yes. If you were in between working or GPR and you're just like, hey, I don't want another year of just, working in a hospital, and I want some real life experience, Aspen gives you a lot. They teach you a lot. GPRs are not necessary in that aspect. But if you wanted to go to GPR because it makes you feel better, or you want to learn a lot about implants of something particular, or you truly just want to work in a hospital setting, GPRs are good for you. Then go to a GPR. So it's kind of a yes or no answer, but I was in between that question when I was graduating, and I was glad I didn't, because I specifically chose public health part time so that I would feel more comfortable with more difficult procedures. But Aspen gives that all to you. So if that's what you're worried about, you're going to be fine at Aspen.
Yeah, to go along with that, we have a whole kind of like a training program well, as you start. We have mentors, like Dr. Tran's spoken about. She's had a mentor that she's able to contact constantly, and a whole network of dentists too during the whole process of her starting, and then still to this day that she can contact. And that's what we try to provide for all of our dentists too. So it's really a great thing that we try to provide for everyone.
And it's a 1 month, usually 1 month program. And if you don't feel good, they keep you in the program for a little longer. But in general, to see most doctors coming out of school from like week 1 to week 2, even, and you're just like, wow, we've grown. And then by the week 3, they're just like, holy cow, I didn't think I could do this fast, or I could do this well, or I'd done like, I had a doctor the other day tell me, in dental school, I had 4 extractions. I did 3 surgicals within 2 days. And
Wow.
you can do that here.
Right. Wow. So giving them the experience that they need, they probably wouldn't have gotten anywhere else.
No.
Um, so what do you think new dentists find frustrating when they first start with Aspen? Or I guess in general, what do new dentists find frustrating?
So you find frustrating is you haven't got dentures. Number one, you haven't got the knowledge to troubleshoot a lot of things, right? And you're just like, oh, I'm in a procedure and I'm now behind and I feel the heat of the next patient. And you're going to be like that, but that's normal. And so you got to make sure you give yourself enough time. Like Aspen's going to sit down and then ask you, how do you feel? Like 3 fillings, like how many minutes do you need? How many hours? Like, do you need an hour for it? Do you need 2 hours for this? Like, what do you need? And they're going to give it to you. But I would gently say, just make sure that every week or every month you're trying to better yourself. So if you're doing one filling for 2 hours, try and do that filling for an hour, within the end of the month. Like, those are the things that you should strive to do better every day. But that's one thing that doctors do right away, come out of school getting very frustrated about is their timing, but because they want to go too fast too soon. And then the next thing is troubleshooting when they're in a situation they've never been in and they don't know how to handle it. They're afraid to ask. And that's where I'm like, I'm here to help you grow. So if you don't ask, I won't be able to help you see a different perspective or help the patient in the moment. So it's okay to ask. And then when they realize that, like it's like a weight that lifted off their shoulders, they're like, oh, I can ask questions. So those are okay. But those are what I find the most hard on new docs.
Right. And then opposite, what, I guess for you specifically, what are you enjoying most about dentistry?
To be honest, at first, like when I came out of dental school, I enjoyed patient care. It was really rewarding. I loved it. And there's some patients that are gonna make you feel bad because they're just not in good mood that day or whatever it is. But in general, it's really rewarding to have a patient hug you and cry after they've never had the money to do anything for themselves, and now they're taking care of their health. So it's really rewarding on that end. Another reward now that I own a few offices and I train a lot of doctors is seeing my doctors grow from day one to where they are now, and seeing how they like their job every day and they're enjoying coming to work. Like they're not dreading it. And my staff, like we come in and we have fun, we joke, we laugh, um, we eat together. Like it's just like a family. And that's what I love the most about the job is it's patient care, but it's also like everything that makes it happen.
Yeah, I've done, this is now my fourth Ask Me Anything, and I feel like that answer is always the same across every doctor that I've spoken to. It's first patient care, second staff, and just seeing everyone be happy, be it patients, be it staff, see it like be the doctors growing. It seems to be unanimous that that's the universal answer of what everyone seems to really enjoy about dentistry.
It's really rewarding.
Definitely rewarding. So someone just posed the question of if you do, because you had mentioned, doing a lot of extractions, but not loving endo and endo root canals. But do you do all procedures or do you do just some procedures?
So I do root canals. I just don't do molars. Just
Okay.
because, I don't have a microscope. I don't think I'm very good at it. I pretty much do everything: crown and bridge. I restore implants. I'm an oral surgeon, so if I wanted to place implants, I can. And I just give most of it to him because he just comes about once a month. So we fill his schedule up to make sure it's worth his time. But in general, you can do anything you want to do, but you got to make sure it's safe. So if you come in and you're like, oh, I'm placing implants tomorrow, but you haven't had any training on it, I'm not going to let you do it. But if if we get you trained up and you feel good about it, I'm going to let you do it. If you want to do a molar root canal, like I said, I can get you somebody who can teach it to you, and you can do it. Um, but if you come in and you're just like, I don't like molar, you don't have to do it. You don't have to do a molar root canal. Like that's just kind of you growing on a professional level too, to know what you want to do and what you don't want to do.
Right. To go along with that, if many of you don't know, we do have an endodontist and an oral surgeon that comes to the office or to many of our offices. So that helps a lot with certain type of endo cases and oral surgery cases. And they go from office to office and assist for that office. So it's a big help. And it provides the accessibility for the patient so they don't have to leave Aspen or go to another office that's further away. We provide the accessibility by giving them a oral surgeon or endodontist that'll come to the office certain times in the month. So that's one of the things Dr. Tran had mentioned a few times. So just in case anyone didn't know, we have our own specialist within the Aspen network, which is really, really great and unique. So we also do, along with the teaching of endo, or if it's implants, we also provide CEs through Aspen Dental. That many of them are just, they're free, they're given virtually, but we do have in-person classes as well. So Aspen Dental provides a lot when it comes to CEs and enhancing learning, be it in person with your mentor or with CEs. So it's a really good opportunity through Aspen Dental and the network.
Aspen
Uh,
has a lot of resources.
yes. um, so you had mentioned before about, being in Minnesota. So your background is you went to dental school in Minnesota. You're from Minnesota always,
Yep, born and raised.
born and raised in Minnesota. So geographically speaking, you ended up working somewhere that you wanted,
Yep.
correct? Okay, wonderful. So if someone were to start as an associate, they want to know how quickly can I become a lead dentist at Aspen Dental?
So this depends on you. Like everybody's learning different, like everybody's different. And some people just come out of the gate and just naturally have it and they just kind of run. And that they can be an MCD within 3 to 6 months if they feel good. If the doctor, the mentor doctor feels good about them. If everything makes sense, then yeah, it makes sense. But if you come out and you want to be lead, but you're not, you're doing 2 fillings in 2 hours every day, like you can't run, you get scheduled, or you don't want to improve yourself, those are the doctors that may not be MCD, or you just don't feel confident, right? You come out and you're just like, I want to be MCD right away, and then you realize like, oh wow, like there's so much I still want to learn, and you don't have to be MCD. You can stay an associate if you want to. Like nothing's pushed on you. Like you have to be MCD by 2 months. You have to be MCD by 6 months. It's really you and your learning curve on what you want to do. And if you want to be an MCD in 6 months, I will train you to be an MCD in 6 months. Because then I will have to push you harder. I will make you go faster. I will give you things to do. I will give you more. And if you tell me, Doc, this is too much, I will lay off and I will slow down. But that's just, it's up to you. So it's hard to say an actual number.
Right. So it seems like a lot of communication between you and that dentist is key.
And growing too.
Right.
Like, let's say somebody's just great at procedures but can't, like you just haven't been through life enough to see kind of people socially. Like maybe you can do fillings all day and you're great and you're fast, but you're not listening to patients, you know? And so that's something I need to work on. Maybe I say, hey, this person's amazing, but there's some growing up to do. And
Yeah,
maybe it will take another 2 months. I don't know. So it's hard to say.
definitely. No, that's great. Um, if for other people that are tuning in that are not Aspen Dental Associates, MCD is a managing clinical director, which is another term for a lead dentist. So yeah, just wanted to clarify just in case. Um, so this was just asked. Charity and giving back is something that's very important to me as a dentist. Does Aspen Dental provide any opportunities for that?
Yes, they do it all the time. So there is something called um, what is it, like Veterans Day. So one day a month, or not a month, one day a year, they give free dental services to vets, and your whole entire office volunteers, like your front desk, your hygienist, your office manager, you yourself. You're taking teeth out for free, you're doing fillings for free. We've delivered a denture for free. Like we've done a lot of stuff with Vets Day, and then after that, they let you during that time. They let you choose one patient that can get the rest of their treatment for free for the rest of the year, like whatever it is that they need. And of course, you're going to listen to everybody's story, and you as a team can choose. But let's say you just want to really volunteer and do stuff. They have a mobile unit that goes around and gives free dental care to vets. They have a program where you go abroad and you're giving free dental care to people in Jamaica. Like it's all the time. It's not just one day out of the year. Like it's anything when you want it to be. So they do a lot.
Yeah, I've been part of the Mouthmobile, and that was such a great experience to see like a line of individuals, of veterans that need dental care, and they're there, and we're here to help, and we go as fast as possible to give them what they need, and it's just very heartwarming to see just the amount of people that came out to support and help. You know, we had like a lab stationed outside of the mobile to get all the dentures, get, you know, whatever it was, they were there to make it happen. And it was just, it's a great thing to see.
You know, and the like bring your team together and the feel the just the pride. You
Yeah,
know, yeah.
definitely. Definitely. Let me see. So this is more based on you. It says, how have you faced any particular challenges, especially being a female dentist in your career to becoming who you are today?
Well, yes and no. Like as a female, as an Asian female, I am a little more like non-confrontational. I just don't like to be in people's faces. Um, but it's like if you do a good job, people are going to notice. And right now, you think it's a male-dominated field, but it's not anymore. Like I've had male dentists tell me, you know what, I think patients just like female dentists more because they're more nurturing, they're more caring. And so, they're like, I think females are better leaders. I've had another male doctor tell me, and he used to say, female doctors are more in tune with people's feelings. Like, we connect better with our staff. And I think everybody finds themselves in a different leadership role. Like, some male doctors are better in certain areas than I am. But if you do the best you can in what you do, it'll shine. Um, I've never been passed over for a job because I'm a female. I've never been passed over for ownership because I'm a female. I, I haven't really hit that hard here. But here in Minnesota, I am the only female owner. But it just happened that way. You know, it wasn't because they wanted a male dominated, Minnesota. It wasn't like that at all. Because it's funny, it's like all the other owner doctors, they all have female associates and they hired them and they love them. And they're always growing them to be, in bigger roles and possible partnerships and all this. And weirdly enough, it happens where I have a lot of male doctors under. Like it's hard to say, but I'm gonna say that role as a female, all you gotta do is do what you do. It's it's gonna be it's only an obstacle if you make it one.
Definitely. That's awesome. I love that. Thank you for sharing that.
Yeah, no problem.
So to transition, I kind of left these questions to the side just to keep things in line. So no, now more COVID directed. Um, how has COVID impacted dentistry for you? Did you have to do teledentistry? Did you not work? Was there furloughs? Were there layoffs? What exactly happened for you?
So for me, in March, when we got the news that we had to close, and we had to close hygiene first, set the hygienist home, they're on furlough right away. Sat in, I knew it was coming. Things were coming down the pipe and they were coming and changing every day. And for me, the hardest part was my staff. I felt like Aspen had my back. I felt secured with Aspen. I felt like we were going to come out of this. But I was worried about my staff. That was probably the only thing I was worried about when I had to go through the furlough for all the staff members. But we talked about it. Like, did we want to do emergent care? Did we want to make sure we were open for patients so then the hospitals don't get backed up? What was safe for my staff? What did they want? And so we as a team decided that they wanted to stay home, and that was okay. And so we furloughed everyone. I included, closed the office. I stay, I'd come in for certain emergencies for my own patients. And it wasn't anything I couldn't handle. It wasn't like a severe extraction or anything, but it was like simple stuff. And it was it was heartbreaking, but yet I knew, you know, Aspen was going to be able to help me out of this, and they did. I mean, we're still coming out of it, but we're still in the pandemic. But it was a, it was good to feel that and to know that I made the right choice to stay here and to be an owner here. It just supported everything for me, but also my staff. With unemployment, all this stuff, they were fine, and when they came back, they were fine. Like their head was, we did it together. So I was never told what to do or how to do it. It was just what was the decision.
Definitely. Um, with that, was there ever a PPE shortage in your office or anything like that?
So when we opened back up, Aspen had secured PPE, and we were able to open back up. And I, with my teams, and I heard them, I listened to them. They're like, "We don't want to come back if there's not enough PPE." And I was like, you know what? There is. We had an abundance of it. We had good PPE, um, and and they did inventory with me and everything, so we knew what we had. We never really had a shortage. It never happened, at least when we came back. Um, and with emergency care that was happening with other offices that were open, they had the right PPE that they needed, but they weren't seeing that many patients because it was an emergency. So they also were never really low. And as of teledentistry, I did do teledentistry. So Aspen did launch teledentistry at that time, and I did do it in Minnesota. with one of my doctors, my associate, and him and I tag teamed it. So we would get 25 phone calls in the morning, 25 phone calls in the afternoon, and we would get on and talk to the patients to make sure they really needed to come in, if there was swelling, if there was, so much pain they weren't sleeping at night. Like, we would pinpoint it that they had to come in. And we would find them a location within Aspen that's open, and we would send them there that's to the closest location. And it worked out well.
Yeah, so no matter what, there was some type of network to send the patient to, some type of office, and you were able to communicate with other doctors if needed.
Yep.
That's awesome. So with that, after you guys came back into the offices, what policies are now in place to protect the patients and staff during COVID-19?
So staff members, when you start, let's say you started the job at Aspen, you have to go through training on how to enter an office. Like, you should come in with street clothes, change into your scrubs, take a temperature of yourself right away, like all these before you see a patient. And um, you have to wear a mask at all times and huddle, everything, and sometimes the masks are locked. You need a breather. Just take it down in a corner somewhere, nobody's there, and put it back on. And that's just how we've been able to maintain our office and making our staff feel good. And if anybody was sick, we don't let them back in. We don't. Um, we just tell them, hey, stay home. And then we call HR. We make sure we follow protocols on whether, because if somebody's sick, like, do they need a doctor's note? I don't know. I'm going to need to call, HR and what the protocol is. And they're always there to answer any question that we have. We had a staff member who was, her husband was sick. And she's like, my husband's sick. I'm like, okay, so let me ask. And they asked, and then she had to stay home and she had to get tested. She was negative, but he was positive.
Oh, wow.
So we had her stay home. The Minnesota Department of Health reached out to her and said, hey, these are the guidelines we need you to follow before you can come back to work. So like, everything was followed. The protocols are there. And if you have a question, you're not sure, because nobody has all the answers, right? There's somebody to ask. And it's their patients feel good because we have PPE. We walk in, we're taking their temperatures, we're asking their questions, we're calling them ahead of time before they even walk through the door, like a day or two out, and we're telling them, hey, we need you to wear a mask. This was weird before Minnesota had a mask mandate. We need you to wear a mask before you enter our facility, and if you don't have one, we're more than happy to give you one. We're taking temperatures at the door. And so these are the things we're doing. And we're cleaning our area once an hour. Like, everything's scrubbed up. And so it's just, that's what we do. To make everybody feel safe. Patients feel safe and your staff.
Right, definitely. So before we end this, I have a question that's a little bit on the lighter note and kind of related to COVID. But if COVID didn't happen, Dr. Tran, what would your summer have looked like? Or what is the first thing you'll be doing when you have full freedom?
Oh, geez. Take my kids to the playground. It's just, like, you're scared. You're kind of scared.
I know.
My children, I don't let them go to the grocery store. Like, I just take them on a trip somewhere.
Yeah.
So they can run wild.
Right. Right. Anything to stretch their legs out of the house.
Pretty much.
That's wonderful. Do you have anything you'd like to just add to let students know or practicing dentists know about Aspen?
I'd say if you come to Aspen and you come because you want to learn, they're going to open their doors with open arms for you. If you come to Aspen and you find that it's not you, that's okay. Just just give them a chance. Aspen's great. It's a great place. And sometimes you go through multiple jobs before you find out what you truly like, and that's okay, but voice it. Nobody wants to be unhappy. Like Aspen doesn't want anybody to be unhappy, none of their doctors. And and so don't be afraid to ask. Just come and see what it's about. Come watch a doctor even.
Yeah, we have great shadowing opportunities and everything too. So if anyone wants to come, just like Dr. Tran said, that was a great ending to everything. It's great advice, truly. Come to us, see what we're like, and yeah, learn from us.
Yeah.
So I just want to thank Dr. Tran. I wanted to thank everyone that tuned in to this Ask Me Anything. If you guys do have further questions, you have my contact information from the emails I have sent. But if you do want to follow up more with Dr. Tran, contact me and I will put you in contact with her for any further questions you may want to have answered just on the side and not part of this webinar. But thank you, Dr. Tran, for everything. And this concludes our Ask Me Anything for tonight.
Thanks, everyone. Have a great night.
Thank you.
It was a good, experience for me to be here to talk to you
Thank
guys.
you. Thank you so much. Thank you for taking your evening, an hour out of your evening for this. Thanks.
Thank you.
Bye.
Bye.